What's up, guys? I thought I'd do another update because looks like I'm about 3 months into testosterone replacement therapy. I wanted to answer a couple questions that one of the viewers asked me. He seems like a wonderful man. His name is Ben, and these questions are questions, of course, that will apply to everybody. Well, they may apply to you, and perhaps they can answer some questions you might have on the subject of low testosterone, depression, anxiety, depersonalization, and then just how testosterone treatment relates to that and how I'm doing. So 3 months in, this is interesting. I decided today, based on the recommendation of a pharmacist and another healthcare professional, to go from, instead of doing 400 milligrams or 2 mLs per 2 weeks of testosterone cypionate, I have decided to go to 1 ml and 200 milligrams of testosterone cypionate per week. And my hope is that it'll perhaps get me a little more level. Well, that's what it should do, right? In theory, that'd be what it did, So I've been taking 400 milligrams every 2 weeks, and I think there's a bit of this and that. It looks stripped. Anyway, sorry. It's like, anyway, staying focused. So I took 200 today instead of the 400, and I will take 200 next week. I made that longer than it needed to be. Okay, questions. So how am I doing? 3 months into it. The short word would be I'm doing better than I was doing before I started treatment, and I'm doing better than I was a month into treatment. I'm doing better than I was 2 months into treatment. So it is a very slow but improving scale, and I'm grateful for that, and it's worth celebrating in a lot of respects. But I just don't feel like I'm out of the water yet. I've been on pins and needles for a long time. Very suicidal, very horribly depressed, a mess. So to be doing better to the point that I'm doing better now is acceptable, and I'm grateful, and I just want to be patient, and I hope it continues. Anyway, sorry. Okay, let's get to it. So a couple questions Ben asked me, and I wanted to address, and maybe they can apply to someone else. One was, he asked, he said, why was there no going back? Why is there no going back from the treatment once you started? So my doctor told me, based on how low my levels were and my age, that the likelihood that my body would naturally start producing testosterone at a healthy level was close to nothing. These are his words, So I did some research, and there's some validity to that, and he kind of just wanted to prepare me for that. Based on some other tests that I had in my pituitary gland, of my pituitary gland's functions, like LH hormone, human growth hormone, of course testosterone, they were all really, really low. So what it suggests is that my pituitary gland is pooped out on me, which is great. I'm so pumped about that. And that's why I don't think I'll be able to come off of treatment. So, you can search some other people on terms of long-term treatment, and they usually say the same, that once you start treatment, it's unlikely that you'll be able to come off. It's a pill that I'm happy to swallow because, like I said, I was so just crazy desperate for improvement that I just don't care. I have no worries about taking a shot once a week as long as I can even just feel okay. I don't care. So that's me. But it is something to think about. The other question he had was, okay, I'm telling you how it's going. He asked how I find it's going, and it's going. It's not perfect yet. I still struggle with certain things a little bit, like mental clarity is getting better, energy is getting better, but it's not perfect. But it is improving. I know you say you feel better, but in what way and how much? What way do I feel better 3 months into testosterone replacement therapy? Anxiety actually has gone down. When I first read that could be a side effect, I was like, oh God, please let that be me, because my anxiety has been one of the most crippling parts of this whole major depressive episode, low testosterone issue. Heart racing a lot, tunnel vision, just dread laying in bed, just so worked up that there's a knot in my chest, feel like someone's sitting on my chest, and then another way I just would feel like I'm existing. That's something that Ben wrote, and I'm really sorry for anyone who is in the throes of depression, anxiety, any mood disorder. and in particular, if it correlates to a low testosterone, possibly, if you're not sure yet, then I urge you, if you're needing answers, to get that checked. Find out and see what might come of it, because I asked for my low T to be checked after a year of doing every treatment you can think of, and it's turned out to be a godsend. Again, I don't feel like I'm perfect. I don't feel like 100%, but I'm grateful for where I'm at 3 months in. I feel like I may have lost track of something. I was like, where was I going with that? Clear-headed. So Ben asked, do I feel more clear-headed at all? Better focus? ? Better memory? ? Absolutely. The memory thing is still coming around. Sometimes I'll be trying to remember what am I doing right now? What am I focused on? Because I just got back to work about 3 months ago, and I've just been able to up the hours to almost like normal working hours just about 2-3 weeks ago. So I couldn't work for the majority of my major depressive episode. I just couldn't. I mean, I was so suicidal. I just wasn't suitable to be at work. I was trying to figure out if I was going to make it through the next day. An absolute wreck. So yeah, clearly it has improved. Absolutely. I can work again, and actually work is slowly starting to get better. I still struggle a little bit with the spaced out feeling here and there, but you know what? It's just, when I add it all up, I can handle it for now. I'm sure people know what I'm saying, I hope. So yeah, better focus, better memory, absolutely, and I do feel more clear-headed. My depression, my low T, because that's been the big difference. Because I've taken a lot of antidepressants, a lot of antipsychotics, mood stabilizers, RTMS, which is magnetic shock therapy. I've been working on trying to figure out why I am such a mess mentally for a long time. So when I found out it was low T and I did something about it, the most drastic changes have come, and yeah, I'm happy about that. I didn't mean for the 7-minute video. Are you still watching? It's a long video. My bad. And one of my main problems. So Ben says one of his main problems is that he feels as though he's not living, more so just existing. And dude, I know exactly. Well, I don't think it's fair to say anyone knows exactly how someone else feels, but believe me when I tell you, I have experienced that feeling to such an extreme for so long that I honestly didn't even know what was going on, or what was real, what was fake. What's the point if you can't feel anything, right? Why live if you can't feel? It hurts. It's uncomfortable. It's just daunting, because it's just kind of like this low pulsing numbness. You just don't feel like you're enriched in anything. It sucks. Hang in there, okay? Hang in there. I'm trust me. The crazy thing about this is you guys didn't see me when I was in the hospital back last summer. Locked up, just so freaking out of control, depressed and anxious and miserable, and checked out and depersonalized that I was ready to slit my wrist. Right? You didn't see me then. So to see me now is mind-boggling. Even though I don't feel like I'm where I pray I'll be able to get. Damn, this is a long video. Well, for the people that this benefits, I feel like I guess it needs to be this long today, but I don't mean to make them this long, that's for sure. It's a long time to listen to me babble. Anyway, Ben, hang in there, bro. I do believe, based on what you've said and what and for other people that are struggling, hang in there. If low T, get your levels checked, and if the levels return anything on the bottom end, figure out what your symptoms are, do your research, and see if treatment could help you. It has helped me. It's weird, when I hear someone say, "Oh, you're like a success story," it's yeah. It's yes, I think I'm proof that improvements can be made. I almost feel hesitant to say I'm a success story, because I'm so afraid to lose the gains that I've gotten, and I need more. I hope to feel better even than I do right now. But I'm hanging in there strong, and yeah, okay, I think that's about it. Damn, that's a long video. If you're still here, give me a pound. You're a soldier. That was a long video. Guys, you can ask me any questions anytime, like Ben did here. For anyone hanging in there, struggling with mood disorders, all over the scale, I do care. I'm very sorry for your suffering, and you can absolutely message me or whatever. And I hope this was helpful. I'm 3 months in of testosterone replacement therapy. I see an endocrinologist in a week. I need to stop this video now because it's too long. All right, take care, guys, okay? I hope that helped. I'll talk to you soon. Very soon, actually, because I got a topic that I need to get off my chest.